I'm Dr. Matthew Hyzy. I'm a board-certified physician in physical medicine and rehabilitation, and I currently run the South Denver Lone Tree office, which we opened up in 2018. My philosophy of medical treatment would be lots of different treatment options or tools to help patients achieve their goals. It's not a one-size-fits-all for any diagnosis or patient. The ortho biologic field is essentially treating the orthopedic system and spine system with your own body's blood PRP or bone marrow stem cell. So treatment of hip arthritis, knee arthritis, rotator cuff tears, ACL tears with the biologics. We have a cell biologist in our clean room lab to hand process in a sterile environment one patient's biologics at a time. This allows the physicians to create a specific concentration and dose for your diagnosis. We're able to concentrate that at a much higher dose and a smaller volume to precisely place that or inject it back into a patient to stimulate healing. And this is starkly different than what we see at other practices in the hospital or orthopedic surgery practices, where it is a simple bedside centrifuge. They are unable to control the dosing, the concentration, and volume of their PRP or bone marrow. Well, during the initial evaluation, there would be a 60-minute consultation one-on-one with the physician, a complete physical exam, neurological exam, and then we use an ultrasound for all the joints and the nerves, also image review for x-rays, CT scans, and MRIs. So if it was a simple joint injection with blood platelet-rich plasma, we have to draw blood the morning of or the day before. A few hours later, we will be in a procedure room like this, using the x-ray and the ultrasound for guidance, numbing the joint, injecting around the joint tendons and ligaments. If it's something more invasive like a bone marrow concentrate procedure or spinal injections, typically we'll have to take out the blood and bone marrow in the morning and then use IV sedation in the procedure room, monitoring our oxygen, our vital signs, and then perform a little bit more advanced procedures where patients are monitored here in the office longer, and then we'll need a support person to take them home a little bit more sore after those types of procedures. So it depends on the procedure how a patient will recover. We want the patients to go through range of motion, physical therapy for a few weeks before they return to full 100% activity. Sometimes it takes 4 to 6 months for complete return to activity for a full ACL tear or rotator cuff tear or somebody that had a spine injury that we're treating more aggressively. With our skill set and the volume of procedures we perform and the research we perform, we have the most experience in all biologic procedures for the spine and the joints in the world. So we have excellent outcomes and excellent safety data for all of our procedures at Centeno Schultz Clinic.